Welcome to the Toxin Terminator, helping people to restore and renew their health by removing the toxins from the home and their lives. Join in as industry thought leaders help you understand the physical and emotional effects these products can have on you and your family, and the safe alternatives you can use to remove the hidden toxins for renewed health. Now, please welcome your host, the Toxin Terminator herself, Amy Carlson.
And we're back for another episode. Thank you for tuning in to the Toxin Terminator. If you are a first-time listener, make sure you're hitting that subscribe button underneath YouTube. If you're listening to the podcast, make sure you hit the subscribe button so you don't miss out in any episodes. We are live every Monday and Thursday, and you can also find us on Facebook. We go live here as well. We so appreciate you coming back in. If you're a longtime listener, we do appreciate you, and we do take your comments and love to see your feedback as you are watching the show live, if that's what you are doing. With us today, I have Dr. Gaila Mackenzie-Strawn with us. She is a certified functional medicine practitioner. She is a doctor of natural medicine, a doctor of chiropractic, and a board-certified traditional naturopath. She has spent better than 30 years in her practice, helping countless and thousands of people find true healing. She also has her own podcast called Your Health Connection, so you'll want to make sure you check her out with that. And, you know, we love having naturopaths on the podcast because we know we're getting down and we're digging into the root of all issues with us. First of all, welcome, Dr. Gaila. We're so glad to have you here.
Thank you so much for having me.
You bet. I spent probably the first 5 years I was in my journey just listening to this expert and, being the guinea pig and trying out what they said and seeing if it made an impact for me, and then flitting over here and trying something else before I really thought about maybe I should be testing to see what's going on with my body. And I know we're going to get into that and really talk about the importance of that. But first, what got you into naturopath?
I suffered from the time I was 2 years old with horrible abdominal pain. I remember climbing into bed with my parents at night. My dad would rub my tummy. Anyway, it was a long journey, and I made several visits to the emergency room, and I was always just told, oh, it's just gas, take activated charcoal. But no one ever figured out what was wrong with me. No one was ever able to tell me what to do to prevent it. So that's why I decided to get into natural health care, because no one in conventional medicine was giving me answers. Also, my mom had a migraine every day of her life. And I just remember every morning my dad would have to make breakfast because my mom always had a headache, and she was in bed with the drapes drawn and in the dark.
Yeah.
For those two reasons, I decided to get into natural medicine to find the answers. And it took years of study and research, but I finally was able to identify why I had severe abdominal pain and severe constipation most of my life.
Wow. And do you find that as you were digging for those answers for both yourself and your mom, I mean, what a blessing to be able to help her. Are you finding that the root of the issues is kind of like not necessarily always the same in everybody, but there's a lot of really similar causes for many people?
Yeah, I've found in my practice of over 35 years that pretty much everything starts in the gut. And that's pretty well accepted now. I'd say probably 90 to 95% of what we see coming in, whether it's patients who have migraines, children or adults who have eczema or dermatitis, or brain inflammation causing anxiety, depression, ADHD, you name it. Pretty much it's starting in the gut.
And that's so interesting because, you rattled off, eczema and joint pain and, some of the things, neurological things that we would never associate with the gut. And in years past, you would get sent off to all kinds of different specialists, right? To try to, isolate this portion of the body and figure out what's going on. How more recently has it been that really science is saying, hey, it's here, it's in the gut?
Well, the term intestinal permeability is now quite well accepted. Doctors like Dr. Fasano, who's a Harvard researcher, a pediatrician, a pediatric gastroenterologist, discovered something called zonulin, which we found the gluten in most of the grains of the United States, because of the glyphosates and the genetic modification of our grains, can stimulate the production of that chemical that opens up the tight junctions in the gut and allows this intestinal permeability, or leaky gut is the lay term. And when that happens, if you're leaking toxins or undigested food particles from your small intestine, where everything's broken down and absorbed, into your blood, your immune system, your white blood cells are going to recognize those particles as foreign and create inflammatory chemicals like histamines that'll cause headaches, cytokines that'll cause joint pain. And over time, if we don't address that and fix it, it can lead to autoimmune diseases, because if your immune system is reacting day after day after day, eventually the immune system can go haywire, and then you could get Hashimoto's thyroiditis or rheumatoid arthritis or lupus or any of the autoimmune diseases that we're seeing now.
Right. And, in a certification I just completed, I was reading one of the research articles that there are now over 200 recognized autoimmune diseases.
Yes, and eczema was just recognized as an autoimmune disease. And in the last 15 to 20 years of practice, I've seen more cases of eczema in children than I did in the first 15. And I really think it's because of what we've done to our food sources. These kids are getting so many antibiotics in their meats, their farmed fish, all the pesticides and glyphosates in our food is definitely contributing to this leaky gut problem, an overimmune reaction, and then you have eczema.
Right. Right. Well, in that overimmune reaction, for our audience, so that they understand what we're talking about, this is like your body saying, hey, I'm in this fight and flight mode constantly. And I'm just going to stay here in this highly elevated, really kind of sick state for a long period of time. I've heard that even with autoimmune diseases, by the time you get a diagnosis that you have an autoimmune disease, that your body has had this for anywhere from 10 to 15 years.
Yes, it takes time, because it's the immune system's being activated month after month after month. And then eventually, and I don't think we know why, it just goes haywire. And then your immune system starts attacking your own cells.
Which is absolutely crazy to me. I know we're kind of glued on this autoimmune thing, but I don't think that people realize that autoimmune diseases, is it your philosophy that autoimmune diseases can be reversed by healing the body?
Yes. Yeah. We have to start by, and we always start with the gut. The first thing that we do is we test, not gas, and you mentioned tests, to find out exactly what's going on in your gut. You have 100 trillion different microbes in your gut, and everyone has to be in balance. So when you take antibiotics, or you eat foods that have antibiotics, like most of our meats or our fish, farmed fish, that balance goes off, because the antibiotics don't just kill the bad guys. They're broad spectrum, so they also kill the good guys. So if you kill the good guys, the bad guys multiply. Now you have what's called dysbiosis. You have an imbalance. And once these critters take over, especially if they move into the small intestine and they go through that leaky gut into the blood, this is where we create inflammation and problems.
And real issues. Now, are you seeing in your practice more of a widespread of this dysbiosis after, especially like this last year, where they were touting use hand sanitizer? And we've got people actively trying to use all these products that, while on the surface seem like a good idea, are actually kind of putting that balance out of whack for our bodies.
Yes, exactly. It's why children play with dirt. It's why we have hydrochloric acid in our stomach is a barrier to any of bacteria or microbes coming in on our fruits and vegetables to destroy them.
Right, exactly. And I've even had read studies where they're saying that, it's not just what you're doing. You're talking about, you're seeing children now, babies, with eczema, that a lot of this stuff is being passed down between mother and child in the womb. It doesn't even have to be that the child has to be born to be experiencing these toxins, that are creating the inflammation process that's happening in the body.
That's right. And if the mother has food allergies, she's passing the antibodies through to the baby. And as you mentioned, toxins are going through to the baby. And then if the mother, when the baby's being born, tests positive for strep, she's getting an IV with the antibiotics. So the baby's getting antibiotics as it comes through the birth canal. And that's sterilizing the good bacteria, the acidophilus in the vagina, so the baby doesn't get that when it inhales. And if the mom has been taking antibiotics and she doesn't have good bifidobacteria in her breast milk, the baby is off to not a very good start, especially if it's a C-section.
Yeah. Yeah. There's so many things and the last thing we want to do is be shaming anybody for decisions that they've made. What I do with our shows is just really providing education so people can be enlightened to, maybe there might be a better choice that we can make as we move forward. So we've talked about the dysfunction, the inflammation that happens in the body, and the inflammation. Well, I said something about the, well, first, let's go back to the inflammation in the gut. Talk to me about when the gut is inflamed. Let's talk about the mental health issues. We are seeing such widespread anxiety, stress, depression, fear, all these things that in an overzealous way. What's the connection in between the two, the gut and the brain?
Well, 90 to 95% of your serotonin is made in your gut. So if you have gut dysbiosis, gut dysfunction, and you're not making enough serotonin, that is our feel-good brain chemical that keeps us relaxed and gives us a sense of well-being. So the antidepressants like Prozac, for example, is affecting receptors for serotonin. But 90 to 95% of that's made in your gut. And also your GABA, maybe 50 to 60% of your GABA, which is the brain chemical or neurotransmitter that helps us sleep at night. It's very calming and relaxing. That's made in your gut. And 50 to 60% of your dopamine, which is that let's get out and do things. It's what motivates us, which gives energy, is made in your gut. So if those are off balance, if you're not making enough, then you're going to likely have anxiety and depression. Also, when you have inflammation, if you have a leaky gut or intestinal dysbiosis and you're leaking those undigested food particles or toxins into your white blood cells respond by producing inflammatory chemicals like cytokines and histamines, and that can inflame the brain. And when you inflame the brain, you're going to have ADHD, you're going to have anxiety. So two things: you have possibly brain inflammation, and you have a lack of production of neurotransmitters in your gut.
Right.
Well, one thing, because you made a good point, backing up. I didn't want to shame anyone either, because there's something we can do. If you do have to have the IV for strep, or if whatever, you can give the baby probiotics after it's born, which we do. And that's something you can do to overcome that.
Yes, I love that. Well, and that's the thing too. I there's so many times where I listen, to how sometimes we can talk, and I'm at this, over here, and somebody might be over here and they don't understand. And I don't want anybody to ever feel guilty about decisions.
I absolutely agree. Thank you for picking that up.
Yeah. Well, because, that doesn't help and serve anybody in any way, shape or form. So we know this, inflammation and this imbalance, not only, if the cytokine, now I can't think of the word to say, but what you mentioned it just a minute, that storm that happens in the body that also affects our immune system, which, we have to keep. The immune system has to be balanced. Everything in the body has to be in this perfect harmony in order for everything to work, properly. So let's spend the last half of our time talking about how do we get there? How do we start from, this point of, imbalance in our body and get us into a state of balance and really optimal health where, we'll have better sleep. We have a boosted, immune system. Our hormones are balanced out. We're digesting and, everything is in a really balanced and harmonious state.
So are you talking about, you mean someone who doesn't have health problems who just wants to stay healthy, or someone who has health problems, and where do you start and what do you do?
Well, let's be real. How many people out there do we feel like don't have health problems? I mean, most of the people that are coming to us have some sort of issue. And a lot of them, it's digestive issues or skin issues or, allergies or, gosh, I eat this food and I'm, bloated and I have horrible abdominal pain or, right?
So the first place we start, what I always start with, is something called a GI map. It's a DNA stool test. It's the gold standard, I think, in testing because it tests bacterial pathogens. It looks for fungal forms, yeast forms, parasites, worms. It has a marker that shows if we are producing adequate pancreatic enzymes to break down our foods. It has a marker to show if we're breaking down our fats and properly absorbing those. Has a marker that shows how much inflammation we have in our gut. Another one, secretory IgAs, is a marker for how robust our immune system is in our gut. 80% of that is in your gut, your immune system. Mm-hmm. So it's a great test just to take a picture of what's happening in your gut. That's the first one that we always do. And one of the things, for years we called it IBS, but now we call it small intestinal bacterial overgrowth. And that just means that bacteria can move from the large intestine up into the small intestine. And it can either, when those bacteria are there, they ferment carbohydrates and produce gas. And there are two different types of gases. A methane gas, and patients who have that, and we can do a breath test for that, tend to have constipation and bloating and gas. Okay. Patients who have hydrogen gas tend to have loose stool or diarrhea, but also bloating and gas. So we test to find out, and we also look at symptoms to find out, does someone have this condition called small intestinal bacterial overgrowth, which is very prevalent now because we eat a lot of most Americans eat a lot of simple carbohydrates, and again, because of all the antibiotics and glyphosates and what we've done to our food. So that's the first step, is to identify what's going on. Then we kill pathogens. So anything we find that should not be there, we kill. And I recommend antimicrobials, herbals, to kill those. And usually we do about 12 weeks of the killing phase, where we kill the fungal forms or the bacterial forms or parasites or whatever we find on the test. We add back enzymes. We add back the proper probiotics. Usually we recommend soil-based probiotics if you have this gas and bloating condition, because lactobacillus acidophilus can actually feed the bacteria in the small intestine and make the bloating work. Then after that, we recommend nutrients to seal that gut lining, to seal up those tight junctions, seal and balance and correct and soothe that gut lining. Nutrients like glutamine and zinc, and there are others. And then we recommend a broad spectrum probiotic with all the good bacteria and the prebiotics, which is the food for the good bacteria in your large intestine to feed upon. And then after that, we usually will move into a detox program, because I don't recommend doing a detox program if you have gut issues, because you're detoxing. If you're detoxing into a gut that isn't working properly, you're probably not going to feel very well. So that's kind of those are the phases that we move through.
Well, and you can kind of put yourself, I mean, a couple of different things. Number one, the great news is the gut lining heals itself very quickly. And that's the great news for all of us. But secondly, let's talk about that. There's a detox cycle. You talked about, we want to make sure that we've got things moving before we try to detox. There's actually this cycle that it actually dumps everything kind of back into the body, would be kind of the easiest way to describe it is just keeps moving through and recycling through the body. That's why we have more of the skin issues, more of the headaches and the brain fog and almost flu-like symptoms, right?
Right. Yeah, probably a good way of explaining this would be the gold standard for hormone testing is called a Dutch. It's a dry urine test, right? And so what we know is your hormones have to be in balance. So if you have any kind of menstrual problems, say breast cysts, fibroids, PMS, cramping, breast tenderness, mood swings during or before or during your period, this usually indicates that your hormones are off. So what will happen? Usually a 25-year-old or 35-year-old woman is not going to be producing too much estrogen. But what we find is there's an imbalance between their estrogen and progesterone.
Right.
And they have opposite effects. And so going back to your idea or your what you just mentioned about the liver and detoxification, your ovaries, your adrenal glands, your fat cells will produce estrogen and progesterone. Your body uses what it needs, and then that leftover estrogen goes to your liver. And there are two phases. It's called phase 1 and phase 2 conjugation. So there are two phases of liver detoxification.
Right.
And what happens is that toxic estrogen, when I draw the model for a patient, I'll show it as little X's in the blood. And that little X, the toxic estrogen, hits your liver, and it has to bind up. So I'll show the X with a circle with a line. So that's a bond. Then it goes into the next phase, and I'll draw like 2 lines with the X and the O. And then they have to go into your colon to get out of your body. Couple things can happen. If you're either phase 1 or phase 2, conjugation's off, that estrogen can stay in your blood because it's not being dumped into your colon. That's a problem because it doesn't mean you're producing too much estrogen. It means you're retaining it, and that's called estrogen dominance.
Right.
So that's one thing. Then the next thing that happens is that bound up estrogen then goes into your colon. And one of the markers we look at on a DNA stool test is a marker that shows it's something called beta-glucuronidase, and it's an enzyme in your large intestine that can break apart that conjugated estrogen bond, liberate it. It can go back through the wall of the colon and back into the blood. And now you're contributing to estrogen dominance that way as well. So the intestine, the GI tract has to be normalized, as well as the liver conjugation pathways.
Right, right. So what I'm hearing is that it's not even that things are we want things balanced out, obviously, with everything, but we also need the body to be recirculating and getting rid of everything as well. It isn't just always just the numbers. It's how our body's using or not using, different things inside. Yeah. It's always so amazing to me. Constipation, you talked about, the depending on the kind of gas people get.
Right.
When I talk to people, especially when they're first into their journey, and I ask them if they're constipated, and they say, no, I poop a couple times a week.
No, you have to be having a bowel movement every single day. Constipation is not moving every day. If you go 2 days, you're constipated. Well, yes.
And then freely, if you have to train and work at it, that's constipated as well, right?
Yes.
Okay. I just wanted to get that out there you're hearing it from somebody besides me. That's the way it is.
Right.
So, okay, so we're working on these tests. We've done a stool or GI mapping test, and we've looked at so many different factors with that. We can have, as a female, do we do Dutch testing on men, or is that just done on females?
Yes, I do Dutch testing on men quite often. I have a lot of men in their 20s or 30s who come in with terrible acne, and the Dutch test looks at the master hormone, pregnenolone. It looks at your levels of progesterone, at all 3 estrogens, your estrogen pathway. So it shows us if your estrogen pathways are not working well. There's 3 different pathways. It also shows us all of your male hormones, your DHEA. It shows us your androgens, your testosterone. is your testosterone converting properly? Because if you're producing too much of that DHT, you're going to have hair loss. And that's why we do it on men who have acne, because very often they have high DHT, so they'll start to lose their hair, and they have acne, or they have high levels of androgens. With women also, if they have high androgen levels, we'll see sometimes acne and PCOS, which has to do with blood sugar imbalance and, you know, insulin resistance. But yes, to answer your question, we definitely do it for men.
Nice. That's good to know that, you know, men need to be checking this stuff out too. Okay, so now we have the testing done. And so we're not guessing at what's going on with us. We're figuring out, all right, here is the problem. What are some, I mean, obviously everybody's going to test a little bit different, but is there sort of kind of a protocol that we're going to walk people through?
You mean how we address what we find?
Right. You know, if we know the gut is inflamed, you know, on 90% of the people who come in, what types of things are we going to suggest? Our top 3 recommendations to really get that gut back into balance?
Well, depending on what we find, but if you have a methane dominant type small intestinal bacterial overgrowth, the best product I've found is something called Atrantil, Atrantil. Okay. Dr. Brown, he's a gastroenterologist in San Antonio, developed it a few years ago. For me, that's the gold standard for SIBO with constipation. That, and I usually recommend a super garlic. Combination of garlic and Atrantil is the best one for constipation. And then I recommend a soil-based probiotic. If someone has loose bowel or diarrhea, Biocidin is the gold standard. And I just listened to a webinar about a month ago. I don't know if you've heard that one, but it's excellent. And this doctor did a presentation on all the studies on Biocidin. She had a beautiful slide presentation. I have 2 pediatricians who are patients, and I shared it with them because I see kids all the time. What's beautiful about Biocidin is it's an herbal product. In their studies, 100% of patients who had diarrhea got rid of it. It's great for eczema, for acne, rosacea. I could go on and on. But it's a liquid. So we can give 1 drop to a 10-pound baby, like, you know, a 1-month-old baby. We can give, you know, 2 drops to a 20-pound baby or 3 drops to a 30-pound baby. So you can use it with kids. It's great for eczema. It really helps. The Biocidin has been shown to kill every pathogen that we see on the GI map. Nice. And it doesn't kill any of the probiotic bacteria. So it's a great product. I always recommend that. And then with diarrhea, you know, it just depends. If there are parasites, then we use anti-parasitic products. Right. If we see H. pylori, then we use something that has mastica and zinc carnosine and nutrients that are going to kill that particular bacteria that can cause ulceration. And then digestive enzymes, if we see low levels of enzymes, or bile salts, if they have, you know, low, poor fat breakdown, and they have symptoms.
Nice, nice. So what can someone do, you know, because a lot of things that we do, we've got to see somebody to get the recommendations, the testing done to know exactly where to do. Do you have things like you've, over your last 30 plus years of working, that, look, for you guys at home, and I'm not diagnosing or treating or anything like that, but, you know, here's some kind of top tips to really help, you know, really just improve the vitality of your health. If you do these things, top 3 that are going to really make a difference.
I would eliminate gluten. If you live in the United States, if I lived in Europe, I probably eat gluten. I won't touch gluten in this country because there are plenty of gluten-free products that are good that you can use to replace. If you're going to eat dairy, if you don't have a problem with dairy, then I recommend pastured. Make sure it's pastured. You know, I tend to not eat dairy, occasionally goat's milk, but, you know, in Japan and in Asia, they don't eat any dairy. They don't have problems with osteoporosis. My sister-in-law is Japanese. She doesn't eat any dairy products. It's not part of their diet, or the Chinese, or most of the Asians. So it's a fallacy to think that you have to have milk products in order to prevent bone loss. So I would say probably eliminating dairy. Actually, let me back up. Top of my list is sugar. Eliminate sugar, eliminate gluten. Those are my top 3. probably, soy, make sure if you're going to eat it, if you don't have a problem with it, that it's organic, because most of it's genetically modified. But sugar is, sugar, when we look at heart disease, I look more at triglyceride levels and sugar in terms of heart disease than I do fat. So yes. Sugar also suppresses our immune system for up to 6 hours after ingestion of any form of sugar. So if you're trying to prevent infections, sugar is your enemy. If you want sugar, I recommend something like monk fruit or stevia or a natural sugar that doesn't affect your blood sugar. But sugar's top of the list, then gluten, then probably dairy. As far as the avoids, what I recommend on the positive side is lots of fruits and vegetables. The Mediterranean diet has been the most studied diet out there, and it's fruits and vegetables. What I advocate is a vegan diet. That's you've probably heard of Mark Hyman, which is partly paleo, grass-fed meats, wild-caught fish, pastured eggs, and lots of vegetables.
Right.
And low-sugar fruits. I ate lots of berries, blueberries, raspberry, blackberry. Yeah, the low-sugar fruits.
That's
the diet I advocate.
I love it. I love that you put a positive back in there. Yes. Last question, and then I'm going to give you the floor to wrap up and give your final thoughts. I always ask my guests, what is your number one best toxin-free lifestyle tip?
Best toxin-free lifestyle tip. I would probably recommend, because I need to look at your work on just cleaning up getting rid of all the toxins in your house, the plastics, all the chemicals in your soaps and detergents. I mean, I see kids all the time and they have eczema, they're covered with eczema, and it's the laundry detergent, or it's the body soap, or it's the shampoo, or the hand soap. I have a lot of nurses, and it's the hand soap that is causing the eczema on their hands. So yeah, I'd throw it back to you.
I love that. All right. I'm going to give you the last couple minutes just to give final thoughts. Do you have anything coming up that you want to let our audience know about? And just finish.
It's been a pretty stressful year, and for everyone, right? So one tip I would say is, I just posted a study on my Facebook page about a week ago. The best thing that you can do to protect yourself from COVID is to make sure your vitamin D levels are good, because they did a study in Europe and then they followed it up at the Mayo Clinic. The patients who got COVID had the lowest levels of vitamin D. So make sure you're checking and taking your vitamin D. Zinc, make sure you're getting zinc in your multi, and vitamin C. I'd say those three, just in terms of the pandemic and protecting yourself. Keeping your immune system really strong when it helps to protecting against COVID. Let's see, what else? As far as what I have. So because of all the stress, I created a free stress support program, and it's 100% free. I'm not charging for it. It has diet. It's a 28-day program. It has dietary advice. It has a shopping cart. A grocery shopping list, menus, meal plan, it's all in there for free. It's all on a free app that you can download. And then I just have tips. It has breathing exercises that, there are videos of breathing techniques to help relax and release stress. And then it has a couple product recommendations just to support the adrenals, B vitamins for your nervous system. So it's a free stress support program. So I just invite people, just go to my website, it's free download.
Nice. And we are scrolling that. If you're watching us live, we're scrolling it down below the screen. It's just Dr. Gaila, GAILA.com. If you're listening, we'll have that in the show notes. So make sure you'll be able to click right through the link. Dr. Gaila, thank you so much for coming on today. You have just been a breath of so much knowledge and information. And I know you have impacted so many people by sharing that.
Thank you so much for having me.
You bet.
That's all for this episode of The Toxin Terminator, and we hope we've helped you remove the hidden toxins in your life for renewed health. If you're looking to continue your journey towards full rejuvenation, reach out to Amy directly by visiting amycarlson.com for your own one-on-one chat session, as well as your free toxic risk assessment. That's AIMEEcarlson.com. And remember, you are just one small change away from renewed health.